Gentlemen, I am advised it is 7 o'clock. So we will start this meeting of the Overview and Scrutiny Committee. Can I first please welcome everybody to this meeting, all the members of the committee who are sitting to my right, for anybody who's watching, and also to the leader of the council, Councillor Stevenson, the portfolio holder for Adult and Health, Councillor Harvey, who we'll be hearing from later, I hope, and Councillors Brown, Cross and Payne, who are here as not members of the committee, but also not members of the executive. And so therefore, I will take any questions, comments and so on from the three of you at any point that you wish to speak. If we are in discussion or debate on a particular subject, I will allow members of the committee to speak first, however, as is the custom. Thank you. Have we received any apologies?
Chair, we've received apologies from Peter French, one of our co-opted members.
Thank you. Record of the meeting. We have received the minutes of the meeting of the 26th. Sorry, we have not received the minutes of the meeting held on the 26th of January. These have not yet been drafted. Actually, they probably have by now, haven't they?
They weren't prepared in time for the publication of this agenda.
So we will take the minutes of the meeting the 26th of January at our next scheduled meeting, which is on the 9th of March, along with the minutes of this meeting. Have I got that correct?
Yes, yes.
Thank you. Do we have any declarations of interest? No. I do not believe we've had any petitions, deputations or questions from the public, nor questions with notice from members, nor notice of motion from members, nor any call-in.
Okay.
And therefore we move to Councillor Harvey, who is going to give us an update on specifically access to GP services, not the whole range of her portfolio, because I think if she was giving us an update on the whole range of her portfolio, we'd probably be here all night. Or are you?
No, I don't think so, Chair. I thought I was here to give an update on the recommendations from the Primary Care Task and Finish group.
Yes, that's access to GPs. That's what it was about.
Sorry, that was confused me because in my head they are slightly different. One being the first being much wider, and what I haven't completely prepared for. So I've got.
We are of one mind, Councillor.
We are.
I'll hand over to Councillor Harvey.
Thank you. For the committee, as we know, last March, the Health Scrutiny Committee published an excellent report on primary care in Rutland. They made 5 key recommendations and they were passed to the Health and Wellbeing Board to integrate into the plan coming from the Joint Health and Wellbeing Strategy. So what I've actually done is I've taken each key recommendation and I'm going to explain how that's been worked through in the past year and where we are. I hope that's okay, Chair. And I've got the button to try and work. So the first recommendation was around accessing primary care services. That was split into a few parts. The first one was around telephone systems and that they should be more straightforward. The second was about considering how vulnerable patients access the system, a patient user group to be established to review web-based systems, to ensure NHS speak was kept to a minimum, and then to support surgeries to improve website accessibility. So in answer to those recommendations made, the Rutland practices continue the national rollout of a cloud-based telephony system. I know in the task and finish group, some members didn't like the new telephony systems and basically on the call centre model. Unfortunately, NHS England stipulate that that's the way they would like things to go. It's also, I think, important for us to recognise that the way the volume of telephone calls now is akin to a call centre. They are getting, at a peak period, some of our practices are getting hundreds of calls an hour, and actually it's impossible if without these cloud-based systems and having the lines in and out, people would just get engaged tones the whole time. So whilst there is a frustration on being number 86 in the queue, rather than having to pick the phone up and keep putting it down with an engaged tone, it does give some awareness of where you are. It's not ideal, and the volume of calls is kind of part of the issue, but equally then we need to find a way round that. But they are continuing to roll that out. It is worth pointing out that all of the practices now do have in the first message that you're given when you call up, that you are now given a direct telephone number if it's an emergency and you need urgent help. So that is something that that has changed, that people can now access a direct number for an urgent call should they need to. The promotion of the website and app booking systems are helping to reduce pressure at peak times. So you can now go on through all websites for the practice websites, and also through your through phone apps if people are signed up to the phone app, and you can do an online kind of e-consult booking system. It's really quite simple to use. You can put your name, your details. They ask you for a brief reason, and then they will ask you for a contact telephone number, and they will then email you back with how they're going to deal with it. So whether that be, if you've given them enough information, they might refer you straight to an appointment, or they will contact you back. So that is another way that people can access without doing the phone queue system. What I think the practices are trying to do, that if your need isn't kind of urgent for that peak time, it would be helpful if as many of us as possible can use the other systems rather than the telephone. And some people do find it easier to use website or app bookings. The digital exclusion is obviously an ongoing issue in Rutland, and whilst a lot of people do talk about digital exclusion as that being only with the elderly and down to whether they can use the systems or not, it does actually miss out a huge number or parts of our population that are digitally excluded because of economic reasons and rurality. So within Rutland, and this has been picked up in the JSNA on the inequalities chapter, within Rutland, if you may not have the money for broadband or for data on your mobile telephone, unlike in urban areas, there are far fewer areas where you can go and access broadband in the community. So in a lot of our villages, you can't just wander off to the coffee place to get it because there is nothing there. So that is being picked up in our JSNA inequalities chapter, because it is something that will continue. So it's just to highlight that digital exclusion is not just left with the elderly because they can't use the internet, which I think is something of a stereotype. And then finally, the primary care network are working with practices around website design, and they are getting working groups together and they want patient groups to help them redesign. One of the issues around websites that prevents them being quite as easy to use is the fact that national guidance states that there's certain things have to be on them, and that in itself makes them quite wordy and things. So it's where the compromise is to for patients to have easy access to the parts they want, but also the compulsory elements that they have to have. Oh, sorry. I've gone. There we are. The next one was communications regarding system change. And this was around your original recommendations were around understanding patients, the new approaches to primary care, increasing the reach of messages, staff helping with the promotion, and that sort of thing. So I'm pleased to say that the patient participation groups are now all active at our practices. That's been a great step forward. The two of the practices didn't really have functioning PPGs. They're now up and running and starting to run really well. So that's fantastic news. There is now a primary care network patient participation group that is also starting to meet regularly. So that is bringing together the 4 patient participation groups with the primary care network, which is really useful. There's a new comms and engagement working group that sits under the operational subgroup of the Health and Wellbeing Board, the Integrated Design Group, IDG, I call it. I might have to check that acronym for you, sorry. The comms and part of the comms and engagement working group, they've actually been given everything within your recommendations, which was around comms and engagement. I've passed their way and asked them to integrate it with it all. So that will embed further in their work from the beginning, which I think is really, really valuable. The PCN are now jointly working with practices on communication. So I don't know whether members have seen this. You've started to see a rollout of certain things we wanted to see. So there was one of the recommendations was on around NHS Speak and kind of making it easier to understand what certain words are and that sort of thing. I don't know whether members have seen, but recently there has been a campaign from the practices on just that, describing who people are, describing who the new service personnel are that are in practice. So that work's ongoing. And as I said, the joint campaigns have highlighted the different roles. Physical and staffing restraints is obviously a huge thing. The Integrated Care Board, I tried to double check this PowerPoint for all the acronyms that I put in and one slipped through, the ICB. So the Integrated Care Board have commissioned a review of the primary care estates in Rutland. I was hoping to actually bring you news that that was done. Unfortunately, it isn't. It's been really delayed, and they reported at the Health and Wellbeing Board that it is significantly delayed and it's going to be started again. Basically, there was work done, but it wasn't felt to be at standard, so it's being redone. There is regular strategic meetings between the Integrated Care Board estates team and colleagues in Lincolnshire and Rutland County Council. It's worth saying that because of our planning issues and the fact that the local plan issues, there have been regular meetings between our planners and the Integrated Care Board strategic estates team. They are meeting regularly and are updated regularly on where building has been agreed. The Enhanced Access Scheme has been implemented. That was a government initiative. So now practices on a rolling rota are open 6:30 till 8 Monday to Friday, and then 9 till 5 on Saturday. It's shared between the practices, and the practices are targeting people for that. So, for instance, cervical screening has been targeted on a Saturday so that they can get extra women in to do it. Our rates had fallen, and so that's actually worked really well to target women, to get them in to have their screening. The new PCN Clinical Pharmacy Academy has opened and been formed. This is about upskilling pharmacists, and they will be doing a master's at Nottingham University This is a really good scheme. It's under the sorry, my word's gone. Apprenticeship, sorry, under the apprenticeship scheme. And the 7 pharmacists are now working in practice and have started their masters. What was really good was, as we know, it's been really difficult to get staff and recruitment's been really problematic. This scheme for these 7 pharmacists was actually overprescribed. So that's really good. And we're hoping that it will lead to people wanting to work further in the PCN. Also at the ICB and PCN level, a workplace development strategy is being introduced. Use of public funds. I know members were concerned around the use of public funds for private practices, essentially. So I just wanted to confirm that actually funds are requested by the Integrated Care Board through their estates mechanism. And so actually, we actually pay Silum Section 106 monies to the ICB as it is now. It was the CCG, and they give the funds over. So we never actually give funds directly to GP surgeries. It always goes through the ICB or the CCG as it was. Cabinet in December, we had a paper, as members will know, on Silum Section 106 monies. Priority 3 on that was healthy and well, and there is 1.797 million under that heading. I just put a little brief there from some of the rules around, or the kind of rules that are around to use it, and that it clearly states that investment must increase provision and not just upgrade or maintain existing provision. And then finally, we were asked to look at a repeat survey. That's actually been postponed and will be picked up next year. So some of the achievements, Oakham Medical Practice has now been rated as good. Obviously, there's been a huge amount of the work from the practice to get from outstanding to good. We only need to look at neighbours across the county line to understand how much work they've actually put in to get there, because other practices haven't turned around so quickly. So the extended opening hours, the PCN workforce developments have increased capacity in the system by substitute roles. So it's kind of helping to move away from the seeing a named GP every time and to go into more specialists, such as the pharmacists and things. And the practices have started meeting to share and compare their ways of working, learning from each other and building better systems. And the most recent data shows that all 4 practices are delivering more appointments than pre-pandemic. So some of the challenges: access to appointments is still difficult for some. Peak phone periods are still problematic due to the number of calls. Obviously, the delay on the estate strategy will have an effect, and recruitment and retention, like in every other sector at the moment, is still having a huge impact on the way they work. Thank you, Chair.
Thank you very much, Councillor Harvey. Do we have any questions or comments? Councillor Ainsley.
Thank you very much, Chair. Councillor Harvey, thank you very much for that very comprehensive report. And I'm really pleased that the TNF group recommendations, particularly the 5 key recommendations, are being vigorously pursued. So I'd just like to thank you for that. I didn't realise that we'd have such an impact. I'm just pleased that we have. I do have a couple of questions, if I may, and I'm quite willing for these to be taken offline at any point. Why is the ICB strategic estate become so problematic? Because obviously with the Rutland Memorial Hospital estate and everything else that's going on, why is that not being pursued more vigorously? And what's actually caused this trip in the road, as it were, or this?
So just to come back slightly, the RMH feasibility study is coming to Health and Wellbeing Board on the 21st of March. That work's completed. What the ICB as a complete system through LLR are doing estate strategies on all areas. they had commissioned a company to do some work, and we were the first, because of our recommendations and our task and finish group, we were the first people to go live. That work was completed, but not to the standard the ICB felt good enough. So therefore they are recommissioning to begin the work again, and that is the delay.
Okay, thank you for that. Is that going to include the work that's recently come to the fore about the MRI scanner?
No, that's separate.
Is it separate to that?
When I talk about the state strategy, that is
So they were
solely,
looking for a state. That's why I brought it
yeah,
up.
no, that is solely to do with the primary care GP estate in Rutland. So basically the
Okay.
4 practices, and then compared to the needs analysis around the thing. So it's solely to do with our 4 practices.
Okay, thank you. I've got a few more questions if I can continue. We recently, Councillor Warren and I recently had the pleasure of doing the joint LLR Health Scrutiny meeting in Leicester. And they did present some interesting statistics, which actually did. The trouble we had with those statistics that we wasn't able to break down sufficiently into Rutland, to get the level of detail that's required for us to actually sort of start making recommendations. But my question, I suppose, really is that why is the patient survey delayed for a year? I think that's particularly in the light of the fact that a medical practice was put into special measures, that we just had enhanced access, and there's been several other measures within the services. And they're really good to get a patient survey fed back to us. Is that something that you feel that, I'm just wondering what your reasons are for not conducting it, and whether in fact we could examine that in scrutiny?
My reasons were quite simple. So originally, if you remember, the plan was to do that in December. But quite frankly, Oakham had literally just come out of special measures at that point and just come through to good. And we were obviously going into a very troublesome winter where everything was stepped up. And there was real pressures on the system. To be brutally frank, I didn't think we would get enough value to warrant doing that piece of work. I don't think that possibly the patients, certainly around, when we look at the results, they were specifically bad around one particular place, and would we have moved that much? And I think it might well be better to give that practice time to show that they're good, and to actually for patients to start seeing that difference before we then redo it. So that was my primary thinking on why it was delayed.
Thank you. Whilst I don't necessarily agree with your reasoning, but I understand your reasoning. I just feel that maybe in the next couple of months rather than 12 months, particularly as we've just had all these improvements, and also because of the LLR joint health, demand is decreasing, etc., etc. So this is probably a good time to see whether we're on the right track, and that's really what I'm trying to determine.
Sorry, Councillor Ainsley, I probably, when I said next year, I was thinking in my head, and I've written it down incorrectly. What I meant was we're going into elections in May. I've actually put it on the forward plan for the Health and Wellbeing Board next working year. So apologies to that. I don't mean in 2024. I mean it would be for the chair of the Health and Wellbeing Board to factor in on their forward plan. It's waiting on the forward plan. That's postponed. I haven't got rid of it. I just gave the reason. So sorry to correct you. I meant the next of our years.
I think it's me correcting you.
Yeah, sorry.
12 months is definitely too long, but certainly May is a lot more palatable. So thank you for that.
I think we need to make it clear that we're talking municipal years,
Yes.
not calendar years.
Thank you, Councillor Waller. That word had lost in my brain.
Okay, I think there's no further questions. I may follow up with some follow-up questions by email, I think, because that was quite a comprehensive report. But thank you very much indeed.
Anybody else? Councillor Brown. Andrew Brown.
Thank you, Chair, and thank you, Councillor Harvey, for your report. My question is about the you mentioned the cloud telephone system, and when you're number 86 in the queue and have to wait for 3/4 of an hour or so before you get through, are you actually charged for that? Because if you get an engaged tone, I don't believe you're charged. So in these straitened times, should it be a free phone number? Because if you're on the phone for 3/4 of an hour waiting, that could rack up quite a lot of charges on your phone.
Yes, I honestly don't know the answer to that. I can pass that on to the PCN.
It just seems that people could be wasting an awful lot of money on just with nothing happening and not getting anywhere.
I'll pass those comments
Okay,
back to
thank
the PCN.
I think we all agree with councillor Brown, and Leader was nodding as well. Could you, when you get the answer, please, councillor, circulate it to all members of this group? Thank you. Was that all of your questions? Any other questions? Councillor Beggy.
I hope you can entertain me with some flights of fancy. I don't understand a lot of this, but I have run some call centres in the past. First question is, where is the technology led by the NHS or is it locally? So how are we keeping up to date with technology such as AI, ChatGPT, etc., and utilising that to reduce call times?
Okay, you're well out of the realms of the Health and Wellbeing Board and my thing for this, because it's an NHS runs. It's an NHS. The NHS England have said that they would prefer practices to use it. Obviously, individual practices are individual businesses, so it would be down to them which cloud-based system they will use. That comes down to them. If you want further details.
I just wondered how they kept up to date with technology, because by the time they got the cloud technology today, that'll be out of date, and how they keep up with the next. With the next one, and I wondered if that's pushed locally by the individual businesses or from the NHS.
I think it's a matter of both. There was national guidance from the Secretary of State last September on this that went down to practice to NHS England, and they in themselves will disseminate it to the practices.
Okay, a second question. Again, without much knowledge of the NHS, do the call centres, so to speak, have to be on site?
Yeah, well, brutally honest, I don't know.
Because again, if the system that they're working from a call centre point of view is completely inefficient. You're either understaffed at peak, or you're going to be overstaffed for the rest of the day. And if I had a utopia, what I would do is I would build a little call centre for all the GP practices, all linked together, where you could flex your staff during peak and outside peak to give you efficient use of staff and to be able to meet those demands. I don't know if that's something that's ever been considered in the NHS or whether or not you could ever do that.
I don't know. What I will do is take that to the Health and Wellbeing Board and see what the PCN think of that. There's certainly where things are going with primary care networks and with neighbourhoods, that now is more possible than it would have been before the development of primary care networks. So before primary care networks, GPs were standalone organisations, businesses. Now they have an umbrella, and in Rutland, we're lucky that all of our surgeries are under one primary care network. It possibly would work with us.
But it just seemed to me that you could have essentially focused admin doing all the calls and the admin for all surgery, so you can flex your staff efficiently, and then the GP practices become points of delivery. Just a thought. It may be completely impractical, but that's how I.
It is one business model.
Please do, Councillor Ainsley.
Yeah, I've got quite a lot of experience, of course, just having installed a few horrible things. You have to think that actually we have a call centre for 111, and the problem is, I think, essentially that no, they do not have to be based, at the surgery. But the problem is that the integration of the IT services for each individual practice, particularly in light of the fact that they are individual businesses, is a perennial problem. It's a huge problem, and it's unlikely, therefore, that you would get a central system, primarily because they're all individual businesses. I'm not saying it's impossible, but it would take, I believe, a monumental effort, and I know that the primary care networks are struggling to actually get their services to be integrated at the very moment. So additional pressures from each of the service GP services.
No,
be
I think
difficult.
I get that. It's just if I was starting from the floor up,
Yeah.
I wouldn't have built it as it is now.
I think the points that both councillors made are fair, but given that we are in the territory of primary care networks and things are changing, I think this committee would be appreciative if you could ask the question, Councillor Harvey, and come back to us. That's the second question you're coming back to us on. I will leave it your judgment, and you and I can liaise outside the meeting as to whether you come back to us in writing or whether you come back to us in person at our meeting on the 20th of April, got 9 in my head, on the 20th of April, and give us an update. But I will leave that for discussion, as I say, outside this meeting. I think everybody will be content as long as we get the answers one way or another. Thank you. Any other questions from anybody? Councillor Lambert.
Thank you, Chair. This is just in relation to the web app you mentioned, booking online. Sounds like a really great way to relieve the pressure on the call centre, the calls being made. Is work ongoing to increase uptake? And are you seeing an increase continually, or is it sort of plateaued? And what sort of percentage of appointments are being made through the app? And what would you like to get it to, sort of?
I don't know the data around percentages and stuff, but I can say that it is working. People are finding it really, really helpful, and there is lots of promotion around using it more. I think what the primary care network is really trying to do is to, as many people, if they're trying to use it to help relieve the pressure around peak times, because even with a great call centre model and a huge call centre, the volume of calls going into the surgeries during that 8 till 9:30, 10 period is so great that even with a massive call centre, people would still be on hold. So it is around how best people, and how it's easier for people as well, because equally, if you've got an ill child at 8:30 in the morning, you haven't possibly got time to be on hold to the doctors because you've got to take another child to school and things. But actually, if those times were freed up, or if you had the ability to quickly go online and do an urgent message to the practice, which you do have, they are answered. Anecdotally, we know that people are going online, doing an e-consult and actually getting appointments that day. So the system is working, but we need to try and change everyone's kind of behavior. And we're all the same. We all know if we really need a doctor, we have to be there at 8 o'clock in the morning to pick up the phone to ring. So we're all doing this. And actually, if we can all kind of, those of us that can access the technology and access the other routes, it would be really, really helpful for those of us that can't, because there are some people who aren't going to be able to use the web technology for whatever reason. It might be exclusion, it might be down to their needs. There's lots of reasons why some people can't. So that's what we need to do, is all of us work together to try and ease it, I think.
Thank you.
Do I have any other questions from members of the panel? In which case, Councillor Gordon Brown.
Thank you, Chair. Thank you for your enthusiastic and positive report this evening. I'll restrict my comments to our recommendation for use of public funds. You suggested that the fact that we pass the money through the CCG to the individual business, which the surgeries are, makes this all right. Well, that was the problem that we identified in the Task and Finish group. And what we asked for was a mechanism where the assets were retained on the public balance sheet and not on the individual business balance sheet. And that was our concern, that we were effectively helping these individual businesses, these private businesses, to improve their pension funds at the end of the day. And I think that was our serious concern in the Task and Finish group. So I am still concerned that from your comment, nothing seems to have changed. We pass the money to CCG, they pass it to individual business, and it vanishes, and it doesn't stay on the public balance sheet.
I share your concern over that, but unfortunately, it's the national way it's done. And so it's unfortunately out of the remit of our Health and Wellbeing Board to change that. That is the national funding model for primary care. And that is how they have accessed Section 106 monies and SIL monies. And that it's a national funding of how it's done through NHS. I can ask the question, Councillor Brown, but it's my understanding it's the national way.
Yeah, I understand every time that a surgery gets more patients, it gets more money. Andy Williams came to Ketton Parish Council just recently. He made that very clear. And therefore, on that basis, we're providing capital, but not asking for a rental on that capital or interest in that capital based on the additional money they're getting. So I just asked that question, and I think I would ask members to remember that as time goes on, because I think it's something as a council we should be questioning. This is money that we are providing from public funds, and it shouldn't just vanish. It should be an asset that the public have, either through either parish councils or through other authorities. But to go to private businesses worries me greatly. Thank you, Chair.
I will add that we were quite, our wording around priority 3 was specific, and that's why it included in the investment must increase provision. So there was quite careful wording, but I share your concern as a member. Unfortunately, it is the national model of how they can apply for 106 monies or SIL monies in this case.
I think Councillor Brown and indeed the working group picked up a really valid point on this one. And I think the question is, rather than give them Section 106, could we not build a building and rent it to them so the building remains in the ownership of RCC? That is a question that could be asked.
We have asked that question. I would say we've put aside 1.797 million, which doesn't come close to how much a building would cost, unfortunately. But the other, I mean, there is nothing stopping us as a council finding a building, and if there was a need identified by the ICB, and seeing if a doctor would come and set up a practice there, so we were landlords. But there's nothing equally to suggest that they would, and that would be the risk, part of a risk on that, unless we worked with a practice. But as Councillor Brown has already identified, some practices have very technical schemes in place for their buildings, and that's a historic issue that we've inherited from I think around 20 years ago. Councillor Brown might remember when the legislation came out.
1948.
Oh, is it 1948 when it was invented? Thank you. Yes, the GP thing was the GPs were never, as when the NHS was formed, the GPs were never, they always had their separate contract. So this is very historic. And then obviously you've got pension pots and everything entwined into it now.
I don't think in 1948 we had Section 106, and we certainly didn't have SIL. I'm just struggling. I think it was 72 or thereabouts, the legislation that brought it in. It is public money. We do not have enough to go around for all the needs that we've got in the county. So I think we have to be particularly diligent about what we spend it on. Health is only one of a number of competing needs, as we all know. We want to do the best by our residents, clearly, but the issue of what is essentially funding the pensions for doctors, I think, is one that we need to keep to the fore and ask questions rigorously at every stage when we're thinking of handing money over to the ICB. Councillor Ainsley.
Thank you. I just wanted to sort of to comment really, rather than the question. It simply says that any time that we as a public organisation, we take money from developers, we then channel that money directly to private, or well, not directly, but it ends up going directly to private practices. Those private practices then make a profit on what they're doing. So there's something that we have to be very careful of here, isn't it? And I think that's the point that Councillor Brown has highlighted. And it's really important that we do keep track of what is happening to the public money that's been put into private business in support of a public institution. It's all a bit wibbly wobbly, isn't it?
Yeah, for reassurance to the panel, and I'm going to ask for Councillor Stevenson or Councillor Brown, I think, to offer assistance if my memory fails me. The last time any Section 106 or SIL money was passed to primary care was to the Empingham extension, which from memory I think was a full council decision. I think it was. I thought it did come. The second lot came to full council, I seem to recall. Everyone, do you remember, Councillor Waller?
In terms of the amount of money, it didn't need to be a council decision, did it?
No,
I think cabinet, but I'm looking at Councillor Brown.
I believe cabinet as well.
Yeah, because I think I mentioned something about parking.
I think actually you're right. It came to cabinet, and then we had a paper at full council, a report from cabinet. I think would be. I just remember to note. Yes, so that was the last. I can say that since I've held the portfolio in the last year, we had one application that was passed back because it didn't fulfil our criteria.
Thank you. Do I have any other questions from councillors who are here who are not members of this committee? Any more from the committee? I have one, if I may, and that is under your slide on primary care achievements. You say that the most recent data shows that all 4 practices are delivering more appointments than pre-pandemic. The grumble I get as a ward councillor regularly is that you can't get an appointment to see your doctor. Do those appointments include all the non-GPs, so the extended hours opening for cervical smears or COVID vaccinations or all the rest of it? Or is it solely seeing a doctor or practice nurse for a problem?
It won't include the COVID vaccinations or the flu vaccinations because that's a separate contract, but it will include, as you said, any other appointment held at the doctor's surgery. So it wouldn't necessarily just be a face-to-face doctor's appointment because they obviously are still working in other ways. But there are more appointments being delivered. The problem is, and as both you and Councillor Ainsley will know from Joint HOSC, the need for appointments has also gone up, and the elective waits at hospital are so high, and we have so many people waiting that actually the need on that is transferred over to primary care because they are monitoring those people. So we're at the moment in a kind of catch-22 situation, which is unfortunate, but they are showing. I think I added that in because there is a belief that there isn't as many appointments, and actually there are more appointments than pre-pandemic, but there is more need, unfortunately.
I thank you for that. It is what I thought the answer would be. I think our residents, when they hear there are more appointments, they think it's more appointments to see the doctor. And I think in our communication, we need to be much clearer. And I think the point you make about having to delay elective surgery and for people to be monitored is an extremely valid point, and it is putting more pressure locally. I don't think that explanation has got out into the public domain very clearly. And I think some of the ICB could do something in their comms to try and make people understand better, because I think people are far more tolerant if they know the situation, they understand the situation. And the public perception is that hospitals are under pressure in A&E, and ambulances are queuing up, and that's what all our difficulties are. And yes, it is some of our difficulties, but it's nowhere near all of it. So that's just a thought, and perhaps you could pass that on. Thank you very much. Well, if there are no other questions or comments, I would like to thank you very much for coming, Councillor Harvey, and we will speak about your follow-up. Thank you. Moving on then to group and panel updates. The first of these is culture. That's been chaired by Councillor Alan Walters. He isn't with us tonight, but he has done a report which is part of your pack, so you've all seen it. There are a number of us on that group, as you will see, who are here tonight. Councillor Baines, Councillor Beggy, myself. First of all, I would like to ask if there, from members of the group, that's Councillor Beggy and Councillor Baines in particular, whether there are any comments you would like to make about what Councillor Walters has given us. Councillor Baines.
Well, yes, thank you very much indeed, Chairman. I know you have been concerned quite rightly with when is the most effective moment in a process for scrutiny to have an input. And I really felt that we were perhaps premature in disbanding the group for 3 months when we could perhaps have provided, I mean, I saw Councillor Walters' point of view, new council and so on and so forth, but I still thought there could have been some rather more positive data gathering between now and the next council. So that's an observation, Chairman. I was in a minority, as you will remember, but it does concern me. We set up something like this task and finish group with decided objectives. When is the most effective moment to both bring them back to this committee and indeed possibly to cabinet? So that's just the observation, Chairman.
Thank you. Councillor Becky, do you wish to make any observations?
Just a couple of things. I think I hear what Ed was saying is two sides to the coin, really. I suppose there's also the issue is that we don't know what's going to happen with the LUF funding. We don't know what happened with the asset review. And my concern is that we could do a lot of work and for the goalposts to move, and we'd have to go back again. We have done a lot of background work and data gathering. So I could argue it both ways, but I still think we should wait until we've at least understanding if the LUF bid is going to happen, which will give us some point of reference. And yeah, that's where I am coming from.
Thank you. I can see both sides of this, as always. I do think that the LUF money will have an impact, clearly. There are other discussions that are underway about the collection, which I don't know how common knowledge it is, but almost everybody I speak to seems to know about them. We also, as a council, are undertaking a transformation review of the council, which could well impact on both what we offer as a museum, as culture, and indeed where we offer it. And it may be that we ultimately get to the point where we are doing something completely different as a council. But there are a lot of balls in the air. And whilst this working group is contributing to those balls, I'm not sure at this moment in time it's quite the right time to try and come to a conclusion. If you look at the paper in front of you, it's got 3 points that Councillor Walters feels needed addressing. The third one of these is trying to seek views from the educational establishments raised, how culture can be beneficial to students. We do have now data on the uptake of visiting the museum from schools, and also the museum boxes, for want of a better term, that have gone out to schools with artifacts in to help them with their curriculum delivery. That's a piece of work that if Councillor Baines is prepared to continue with, I think would be extremely helpful, because it is part of the background information that any group picking this up post-election will have, and not have to start again from scratch on that. Do you agree with my assessment, everybody? Nods. Councillor Baines, are you prepared to continue with that particular piece?
I'm perfectly happy if it's going to be useful. I mean, how would you see that? Because we no longer have the task and finish group in operation. Would you see that, me as a member of this panel for the time being at any rate, producing that information?
Yes, I would. We do have pieces of research, as Councillor Beggy indicated, that have gone together towards this task and finish group. We will make sure individually as councillors that they all go to governance, so they are collected together, collated, so that when the new overview and scrutiny committee is in place post-election, it can pick this up with all the research that's gone on in the last few months. It will be current still in that time, and take it forward. That would be my view.
Yeah, thank you very much, Chairman. The one little bit of assistance that I originally asked right at the beginning, and directing it to governance, that if they could cause copies of a letter to be sent out initially, that would be very helpful.
I'm sure that's possible, is it not?
With the contact details provided too, so we know who we're contacting, of course.
I think it would be going to the schools, and we have that database.
Thank you very much indeed, Chairman. Thank you.
Thank you. I would like to move to two. I'm going backwards in this list, as is my wont. I think also, again, this is my view, and the others please come in, that given that what has happened, I mean, when we started this group, we didn't even know we were going to be bidding for LUF funding, levelling up funding, sorry for anyone watching. And so I do think that the new group needs to revisit the terms of reference. Do we agree on that? Yes, I'm seeing nods, so I think there's an agreement on that. And therefore, I propose that we stop the group now, other than the pieces of work I've mentioned, and that we ask the overview and scrutiny committee that is appointed at annual council in May to pick this up as a piece of work for which some background has already been done. Clearly, we cannot direct them to do it. We can only request that they consider, because they will make their own work programme. But that is my proposal. Do I have a seconder? Thank you, Mr. Beggy. All those in favour, please. Unanimous. Thank you very much. Do you have what you need, Tom?
Yes.
Thank you. Oops, sorry. Moving on then.
Chair, could I just ask, if I may, is it 24th of January 2022 or 2023? On the task and finish?
It should be 2023. It's a
Yeah, no,
typo.
just with reference, not knowing about LUF bidding.
No, the task and finish group started before then. It started in August, I think, August. And at that point, we didn't know we were bidding for LUF when we wrote the terms of reference.
August 22.
August 22. Okay. Customer experience task and finish group, councillor Beggy.
Thank you, Chair. For reasons which I won't go into in public session, but the Chair is aware of, and the chairs of the other task and finish group, for reasons I've had to step down from those groups and from this group, and unfortunately put this on hold for a couple of months, probably after the transformation programme has come to some conclusions. But unfortunately, for the time being, which Gail is aware of, I couldn't continue with it.
Again, can I ask that this is reconsidered by the new overview and scrutiny committee, because it is very much tied up with the transformation programme in any case, and it may or may not be appropriate to take forward when we know the outcome of the transformation programme. I wouldn't like to say either way, because I've no idea what that outcome is going to be, and I don't think any of us do at this stage. So can I recommend that, again, it is recommended that it is considered by the new overview and scrutiny committee? Do I have a seconder? Councillor Beggy, all those in favour? Again, unanimous. Thank you. Moving on to C, Economic Strategy Task and Finish Group, Councillor Brown.
Thank you, Chair. I've been in contact with the Director of Places, and we've arranged for a follow-up task and finish group meeting for 5:30 on the 21st of February before the special council meeting of that date. The intention being to talk through the framework and draft economic strategy and the emerging interventions and policy areas. And I will circulate more information to the members of that task and finish group in preparation for the meeting on the 21st of February.
Thank you very much. Does anybody have any questions of Councillor Brown? No, fine. Well, all will be revealed in due course. Highways and speeding. This would have been an update from Councillor Paul Brown, who unfortunately is poorly, so can't be with us tonight. And so we have no update at this point in time. I will, however, email Councillor Paul Brown and ask him to provide a written update or come in person to the next meeting in March. Thank you. Moving on to E, Homelessness Evidence Panel. I apologise that I'm talking a lot tonight. You'll get really fed up with my voice, but I actually chaired this particular working group. You have had the report, and before anybody does what I always do, there is one spelling mistake and one incorrect use of an apostrophe in the report that I noticed today when I was going through it yet again. So I apologise for that. It is totally my fault, as I typed it in the first place. But I am aware that I was somewhat less than perfect in this occasion. Yeah. I can't get it out of my folder to get to the bit I want. I think the report itself is self-explanatory, and after you've had a chance to talk about it, what I propose doing is asking you to approve the report or receive the report, first of all, and then we will go through the recommendations one by one as they appear at the end of the report. So it is what it is. Are there any questions or comments? A number of people who were on the group, and I would like to thank all of you, especially those who are not members of this committee, and everybody put in a lot of hard work getting to this point, a lot of research, legwork. So thank you very much for that. And also I'd like to thank the officers who were supportive throughout and helpful throughout. All the officers, both from the People Directorate and from governance. Are there any questions, as it's quite a lengthy report. Councillor Payne.
Thank you, Chair. I just want to say, as somebody who was on the committee and who helped draft this, and as someone who's done quite a bit of research over the years, that I think the methodology stands up very well. This is a very good piece of research, regardless as to the actual topic involved. And you know, I'm quite proud of the sort of academic rigor that was put together to make this the report it is.
Thank you. Any questions? Councillor Baines.
Very much, Chairman. Looking at table 1 in this report, and I mean, I think I'm not suggesting any solution. I'm simply underlining the difficulty. 47% of the reasons for homelessness come under what I would call personal or domestic reasons. I think it is extremely difficult for any local authority, let alone national government, to legislate in a way that meets a need. And we've always in this council had a very long and proud tradition, I think, of meeting this sort of need. We've gone on the demand, but it is extremely difficult, I think, to budget both in terms of resources and money on things that are personal. You're almost in a position of making a moral judgment on the situation that those people find themselves in. You know, George Bernard Shaw, the deserving and the undeserving poor. And I certainly don't want to be cynical about it. All I'm saying, Chairman, is I don't think there's any easy solution. I mean, I think this is a very good and full report, but in many ways it needs delving into a bit more deeply. And I think the first of your recommendations was, again, the leader sitting here listening to this, that one portfolio holder, whether it is the one present with us tonight or whoever, should have that as a definite priority. And it's, I take the point in the report that because we are a unitary authority, we haven't got the difficulty of the various different directorates. We can use it more effectively, shall we say. We're not silo mentality on it, but I do think it is important that one portfolio person, I entirely agree with the recommendation, should have that as a major thing. And that, in a sense, it sounds as if I'm contradicting myself, but that enables that individual portfolio holder to go across the different directorates. And so I think, now, I don't think it's going to be the solution, but I think it might be a way of breaking down what we can have an influence on, and what, in fact, whatever we do, we're up against that very well-known phenomenon, human nature. Thank you, Chairman.
Thank you. Any Councillor Becky?
Just sorry, again, on just table 1, actually, just seek a little bit of clarity. The figures, for example, 167, is that 167 people at that point in time who were reporting homeless, or 167 people over that period, December to July, who had reported as homeless?
It's the number of people over that period of time who were assessed as homeless by the council, because not everybody who reports as homeless is accepted, because there are legislative constraints about who is.
I think my question is, at that point in time, it wouldn't be 167 people as homeless, because some of those would have been rehomed and.
Indeed,
Yeah,
it's
okay.
the ones who had reported as during that
Correct.
period.
It's not the actual homeless.
No, it's not the people without home, no.
Okay, thank you.
Mr. Menzies.
Yeah, I'm not sure I've got questions that can be answered really, but first of all, what actually, I think you might have explained it, but what actually classifies as homeless in your report will be people that actually present as homeless, because there are homeless who don't present themselves. So I'm not really quite sure what you can do about that, but there are several in various areas that I have something to do with. There are veterans who are homeless who don't come anywhere near the council to declare an issue because they stay away from authority. There's also the churches together who have houses for, is that taken into account, the homeless that they're housing?
I can't answer that without knowing the details of individual cases, and we didn't go into that. I can say that the homelessness team, the officers within Rutland, are very aware of the Churches Together activity and what provision is available. So putting those two bits together, I can assume that there is appropriate liaison. The portfolio holder is nodding. She obviously has access to more detailed knowledge than we did. Councillor Harvey.
Thank you. I can come in on the veterans and offer some reassurance that there are, we have an armed forces officer who works very well with charities and offers an outreach service. So whilst I appreciate veterans are a vulnerable, harder to reach group, we do have within the county, we do have networks that do assist them. We have some reassurance around those that we do offer a service. And you're right, obviously this isn't just specifically rough sleepers. The homeless policy will encompass all those kind of in need of a home, whether they be sofa surfing and so on and so forth.
Thank you for that. I would also add that that table is a simplification of a lot of data that I was given, and the data included data about service personnel who found themselves in difficulty. So it is a category that the council is very aware of, and indeed under the policy does gather points apart from the legal responsibilities that we have for veterans. Prior to having the legal responsibility, we did allocate points for homelessness for them within the points-based system that is operated within Rutland. And as far as rough sleepers are concerned, we don't just ignore them, appreciate they don't come into the council, but our social services teams are very aware of them, and every report we get of what might be a new rough sleeper, there is a team goes out to see them and support them. But you will appreciate that not everybody wants council help, and some, not many, but some rough sleepers, it is actually a life choice, and one has to respect that as well.
Thank you very much.
Any other questions? Councillor Cross.
Thank you, Madam Chairman. You alluded to military personnel. Now, would these be serving personnel or families of serving personnel? Because in my book, a serving military person would never be homeless.
It would be the families where there is family breakdown. Councillor Harvey.
I was going to say and veterans. So it would be families and veterans within this. And also those leaving service. So it could be those leaving service as well.
It just needed to be clarified.
Thank you, Councillor Harvey. Did you want to come in, Councillor Stevenson?
No, I was just looking over at our armed forces champion for nods of assent with what was being said.
I should have been nodding and I wasn't, but yes, I am nodding.
Do you wish to add anything, Councillor Ainsley?
No, I think the veterans provision is a very valid point, and I think that actually there is an awful lot of work being done by our veterans officer who's actually armed forces officer who's doing sterling work.
Thank you. Are there any other questions or comments? Councillor Harvey wants to say something.
Can I have a comment on a recommendation, please, which is I just, maybe some clarity, or just around the wording. Obviously at 6.2, sorry, Chair, I should start by commending you on this report. It's a fantastic report, and so well done to the panel. It really is a fantastic piece of work. And I'm kind of nitpicking over wording, and there is a reason for that. So 6.2 talks about housing people as a result of domestic violence, and obviously is covered by the new domestic violence legislation. And I just want to clarify, because in it, we're recommending that the portfolio holder monitors the placement of victims of domestic violence on a regular basis to ensure they're safe and their needs are met. So I just needed clarity on a couple of points, because obviously under the new legislation, all children in families of domestic violence are now classed as victims in their own right. So I don't know whether we just want to maybe amend the wording slightly. There's also a bit, and again, we might need to take this offline. I'm going to be very careful what I say here. With regard to refuges, and obviously I would look to the panel who looked at this part, whether they were aware of refuges and whether they had some guidance around that. I'm picking my words very, very carefully, and I'll happily take this offline with you. Obviously, it might be that people placed within the county wouldn't be known to us for very specific reasons. So I think we need to be very clear. I'm happy to, I appreciate I'm talking like I'm talking in tongues at the moment. I'm trying very, very hard not to say the wrong thing in public, because it would be straying into exempt just for safety reasons. Obviously, people appreciate around domestic violence, there's very strict rules around this. So I'm alluding to things, but I just wonder whether it's worth having a conversation outside. How that says now, there would be problems with it for very specific reasons that I'm happy to go into with the panel and chair in private session. I apologise that I'm talking in code over that, but I felt it needed to be said.
I can say what we meant by it, certainly, without going into private session. I'm going to let Tom have a think about how we might want to word the recommendation while I answer that. It may be that we need to move into private session for a few minutes to explore it further. But basically, we were looking at the placement opportunities for victims of domestic violence, women in particularly, in Rutland, and recognised that they were not all filled by Rutland residents. And some of that, as we said in the report, is perfectly legitimate, because if you're subject to domestic violence, you may well want to be placed some distance away from where the violence took place. So our residents are placed elsewhere. And I think what we are trying to get at is how quickly they get placed. Do we then keep in touch with them so we know that everything is progressing as it ought to be? And if there are children involved, what happens to their education? And it's not that we as a committee are asking. What we're saying is that we want Cabinet to be, or the portfolio holder to be obviously monitoring this. Councillor Stevenson, do you want to come in on?
Well, I was just saying, presumably there's an opportunity, obviously, for this to be looked at outside of this meeting, and any sort of tweaks to recommendations.
Yes, there is. And furthermore, these recommendations are recommendations to Cabinet. The Cabinet itself may choose to ignore all of them, any of them, or amend, because that is Cabinet's prerogative.
Yeah, so I was just thinking the points that you were making, we can, and if necessary, we can have a sort of exempt session.
Or Cabinet is free to amend the recommendations at the point it comes to consider them as well.
Yeah.
But that can be done in consultation with the committee as well.
Okay.
Would it help, Councillor Waller? Apologies. Would it help if you and I had a conversation outside of this outside, and then you feed back at the next meeting? I just think we need to tweak the words slightly.
Yeah.
I fully get where you're coming from, and actually I think there's just some nuances that I think it's a very valid recommendation, and that's why I don't want to. I wanted us to be able to utilise it, if that makes sense, to its fullest.
I think I have a way forward. My way forward will be well, we're going to go with it. I don't care what you say, I'm chairman. We are going with my way forward. Are there any questions or comments before we progress? Councillor Ainsley.
I really want to reinforce the comment that was made by Councillor Harvey, reference the fact that young people associated with domestic violence are now in statute considered to be victims, and that does actually change the dynamic quite dramatically. And I also look at these recommendations and think there are some necessary tweaks to be made.
Are there any other comments or questions? In which case, first of all, I would like to recommend that this committee accepts this report. Do I have a seconder? Councillor Beggy. All in favour? That's unanimous. Sorry, did you not have your hand up?
No, I didn't. I'm abstaining.
With one abstention. It was however many there are of us with one abstention. Okay. Right, we will now go through the recommendations. I propose that we go through them one by one. For recommendation 6.2, my proposal is that we revisit this recommendation only at the meeting in March, that's March the 9th. And that between now and then, I have another conversation with Councillor Harvey to get some wording that the Cabinet, Councillor Harvey in particular, are happy is clear enough. And also that we take account of the position of children and the law in this. This is a very difficult one, of course, because we don't allocate housing to children, and this is about allocation of housing. But nevertheless, I'm sure Councillor Harvey and I will come up with something. Are we happy, therefore, that we delay 6.2 until March? Yes, I've got nods of agreement. That was my proposed way forward that I would go with. Okay, so 6.1, that the leader of the council designates one portfolio holder to take the lead on housing, and for that person to actively engage with her colleagues as appropriate on housing matters. Do I have a proposer? Councillor Beggy, seconder Councillor Toseland. All in favour, please.
That's 8 at the moment, Chair.
Thank you. Against?
I wasn't counting.
Abstentions? Councillor Baines is abstaining. Okay. 6.2, we are deferring. 6.3, sorry, that was carried. I beg your pardon, everybody. 6.3, the RCC explores with its registered social landlord the possibility of increasing the number of homes in Rutland available for temporary accommodation. Do I have a proposer? Councillor Beggy, seconder Councillor Andrew Brown. All those in favour?
8, Chair.
Against? 1. Abstentions? None. That is carried. 6.4, that Cabinet, as part of the Council's asset review, explores the options for developing new temporary accommodation in Rutland to house those who have been made homeless. Proposer, Councillor Bill, seconder Councillor Toseland. All in favour, please.
8, Chair.
Against? 1. Abstentions? None. That's carried. 6.5, that RCC reconsiders the development of a choice-based lettings policy using learning from other councils' policies and in consultation with registered social landlords to better meet current needs. Do I have a proposer? Councillor Bull, seconder, Councillor Andrew Brown. All those in favour?
Unanimous, I believe, Chair.
Thank you very much. That's carried. 6.6, that the housing allocations policy be reviewed. So, and there's a mistake there, it shouldn't be a 2, so that it is transparent and easy for applicants to use with a user-friendly customer guide, and it takes into consideration aspects highlighted in this report, e.g. means testing, and the needs of the over 60s in the context of an increasingly elderly population in Rutland, and that the type of accommodation they could be considered for. Do I have a proposer? Councillor Andrew Brown, seconder, Councillor Bull. All those in favour?
Unanimous.
Thank you. That's carried. 6.7, that Cabinet review the contract with Peterborough City Council for the provision of services in relation to private landlords with a view to improving data collection on the private sector in Rutland. Are you proposing that?
No, Chairman, I would like to make a comment if I may.
Very well.
Thank you. When Cabinet, should we approve this, could they look very carefully at the questions that are being asked to elicit this data? I will declare interest as someone who some years ago took on a Rutland social thing. I had a dreadful experience. I would, as I sit here at the moment, certainly not consider taking on any social tenant, and I'll explain why. A panel looked at the rent which was agreed in advance and found that it was too high. I then came to a meeting in this chamber, Madam Chairman, where a fellow member accused me of being the Ruckman of Rutland. I got it withdrawn. It may have been meant facetiously. It did not go down well. That same tenant, in tragic circumstances, which I'm not going into, was then in effect squatting rent-free in a property for several months, supported entirely by the housing department of this council. I'm simply making that point that when that data is collected, I think the safeguards for a private landlord, because in principle, I thought I was doing somebody a good turn. In practice, I ended up both losing a lot of money and possibly some reputation. That was the point I wanted to make about the criteria. I entirely agree with the proposition. I think Cabinet should look at Peterborough's conditions and so on and so forth, but please bear that in mind. Thank you, Chairman.
I think for piece of clarification, and Councillor Payne may want to come in on this. When the group started this piece of work, we wanted to know how many houses there were in the private rented sector, what size they were, and over the last few years, how many had been lost to things like being sold or becoming let for holiday lets, that type of thing. And we discovered that Peterborough City Council had all that information for Peterborough, had none of that information for Rutland. And so the reason for this recommendation is basically you don't know what you don't know, and you need to know it, basically. It's not about trying to persuade private landlords to take any particular type of, or not only to not take any particular type of tenant, but actually it's not about trying to persuade private landlords to take tenants at all. It's simply knowing what your market is.
Yes, I was the one who made the phone call and got the shocking reply, we don't keep your data for you. which I thought was a bit strange for a subcontractor, but there we are. And it was quite shocking to all of us who were on how hard it was to get basic, what I considered basic data, like, you know, how many properties are there? Where do they come from? Where are they going? It was that quite a shock to the whole. We had to do a lot of digging, which we shouldn't have had to have done.
My point about availability, not about persuading or otherwise, but you would come and see that I had theoretically rented property. But I certainly, as I sit here at the moment, would not be looking at social tenants. So therefore, all I was asking that there was sufficient nuance in the data so that we got actual availability rather than theoretical one. That was all, Madam Chairman. Thank you.
If I may, I absolutely agree with nuance. I'd just like to have the data first before I could put the nuance to it.
Thank you. So it's recommendation 6.7 that Cabinet review the contract with Peterborough City Council for the provision of services in relation to private landlords with a view to improving data collection on the private sector in Rutland. Do I have a proposer? Councillor Toseland, seconder, Councillor Bull, all those in favour, please.
Unanimous.
Unanimous. Thank you. That's passed. And the final recommendation was that Cabinet review the Housing Services Review Strategy and Operations Group, ensuring that it or any successor group has clear terms of reference and appropriate membership. Do I have a proposer? Councillor Bull, seconder, Councillor Ainsley. All those in favour?
Unanimous.
Thank you very much. So those recommendations will be passed through to Cabinet. And as I said at the beginning, we can only recommend to Cabinet. Cabinet is totally free to accept, reject or amend any or all of our recommendations. That is the due process. Leader.
Chair, is it possible, because on some of those, I think it would be helpful for us to also have it at the Housing Services Review Group as well, just because there are some things that are quite technical that I think we need input, but there are other things that are straightforward for Cabinet, such as 6.1.
Yes. If you would like to have a discussion with me outside this meeting, I'm more than happy to do that. I would say, though, that the staff within the People Directorate who operate this have been enormously helpful in explaining all the technicalities to the working group. So I'm sure they would do the same for you as well.
Thank you.
Okay. Moving on then, Minerals Authority Contract Evidence Panel. This one is slightly more complicated in that it was set up as a working group, but I'm not sure that Councillor Beggy feels that's quite what we need.
No.
Sorry, microphone.
Very forceful, Tom. You scared me. Off the track now. I feel threatened. Yes. All right. Yes. This is some of my own doing, actually. This was always intended to be a report looking at the performance of the new minerals contract, which came into date just over a year ago, or about a year ago. We've put it off to now because Gordon and I felt that we needed a year's amount of data. The criteria against the performance metrics in the minerals contract with what we wanted reporting against, such as how many visits, what visits were done, who did them, and what was the output. Where I fell foul of the system was, I believe the document I put it into was a standard template which all of these requests had to go into. So I shoehorned my report request into a evidence panel request, which somewhat confused Penny, but we did clarify it yesterday. So Penny is fully aware that it's a report to come back to scrutiny, which we can read and then question on the night. If you miss out all the superfluous bits, which were with target finish group, the one of real importance is the issues to be considered in point 8. And
obviously everyone has read that, but any that I may have missed that we can add into that. So we've got a full set of everything that we want to look into. Just to put it into some context, it doesn't impact all of you yet, but certainly Gordon and mine wards are very much overrun with quarries. They pop up while you're not looking. And the legislation is constantly changing. And the impact on health, the evidence is now growing more and more to what it does for residents. And a lot of the county is built on this limestone. So it could impact everybody, but it does impact a lot of our residents. And we need to make sure that it is being monitored effectively, both by RCC and NDC, who we outsource to. I think that's the summary, unless Gordon wants to add anything to that.
Chair, yeah, I think it does. I think a very good summary, and I do appreciate the work that Councillor Begg has put into it. The one issue that both Councillor Begg and I have with the contract is that the operator of the contract, Northants Council, has had a significant change of personnel in the last 12 months. It's another area which maybe we want to just add into section 8 to the issue to be addressed, is that turnover of staff and what the objectives are of the authority accordingly.
Yes, so we can clarify some of those terms. It's somewhat caught up in 8.3, I think, ability and staffing of NNC to carry out terms of contract. But yes, I see that. And I think what's also important, Chair, is point 8.12, who we would like to attend those meetings, which I've explained to the importance of those people being there.
Thank you. Now, my understanding is that the director will have a report ready for us for our meeting on the 9th of March. And that's then April the 20th.
Can I just clarify, Chair, that this is not politically sensitive anyway, is it? So it doesn't impact by bird, I don't. Wouldn't have thought so.
I think not, but we will make sure of that before anything is published.
A rock's a rock at the end of the day.
We are contract monitoring, which we need to do, I think, is the answer there. Yeah. So we're talking about the 20th of April. You've indicated that you would like Roger Ransom and Ingrid Hooley from the Officer Corps Rutland to be present. Yes, it's Hooley. I believe that it would be Councillor Powell from the Cabinet, please. And we would also like a representative of Northants District Council, who hold the contract. It's been suggested that Mark Chant is the appropriate person, but can I ask governance to clarify that with Northants?
Well, ultimately, it will be the Director for Places who is the one that is accountable to the committee, so they will make sure that someone who fits the criteria is available, rather than this committee specify individual officers at this point.
Thank you. Councillor Brown.
Thank you, Chair. Just for information purposes, Mark Chant is the Head of Planning Services, Mineral and Waste, and he's the only consistent person that's been there prior to this contract and now with this contract. Everyone else has turned over. So that's the reason it's suggested. And it's not a demand.
Just to add to that, the reason we are requesting Roger and Ingrid is because they both have been attending the Rutland Quarry forums and are very aware of all of the working movements of this problem.
Can I ask that governance make it clear to Northants why we are naming this particular person? Clearly, as a local authority, it will choose who to send and might even decline. I don't think we would be too impressed if they declined to send somebody, though, given that we are paying them for this service. If that's all on that, then are you content with that, Tom? Fine, thank you. sorry, moving on to the review of the forward plan. We have for our next meeting in March, not minerals, that's April, sorry, I apologise for that. We have the Levelling Up Fund. We have the Leicestershire and Rutland Integrated Care System performance data. Councillor Wilby is coming to talk about the Visions Children's Centre. And I've also asked that he very briefly explains the process for the childcare review that's currently, well, it's going to start on Monday. That's just for information for us, that particular piece. And we will have the outcomes of the MyCare CQC inspection. So that's quite a full meeting. Does anybody have any requests? Councillor Harvey, you wish to speak?
Sorry, Chair, it's just to give my apologies. Unfortunately, I've got a pre-existing diary date for that meeting, so I won't be able to attend. So if there's anything for me, can it be added on to April if possible? If not, I can give you a written response, but I just wanted you to be aware that I have a pre-existing appointment that night.
Thank you. The indications we've been given is that the MyCare inspection isn't going to throw up anything that's going to cause us a great deal of angst. And on that basis, I think we take it. And if there's anything further, we'll call you back in April. But if there isn't, you have a night off, as it were. That's all right. Thank you very much, Leader. Thank you. That's very helpful. In April, we have the minerals that we've spoken about, and we're also going to have an update on the CQC framework. Now, for those who are listening remotely, this isn't about an inspection, it's about the way we will be inspected in future. There are big changes ahead, and we felt it is absolutely essential that members are aware of the implications for us as a council. So that is coming in April, and it will give us ample opportunity to ask questions about it. Anything anybody wants to raise that they feel we should have included on the agenda in this municipal cycle and haven't? No? Thank you very much. I have no any urgent business. I would, however, like to remind members, you will have all been informed by email, but to remind you that we are having an additional meeting on February the 21st, following the council meeting. The council meeting will be short because it is only a one agenda item meeting. I hope it'll be short. When we have had council meetings on the same agenda item previously, they have always been short. So I'm assuming it'll be short. We will follow straight on. It's an additional urgent item meeting, and it's about the Catmos Sports Centre. So that's the 21st of February. And the date of that is the date of the next meeting, obviously, but the date of the next scheduled meeting is, as on your papers, the 9th of March. And thank you very much. And I close the meeting at, is it 20 to 9?
No, 8:38.
8:38. Thank you.